All right, real cause of asthma. What's going on, everybody? This is Dr. Sheldon with Secoya Health. Today we're talking about the root cause of asthma. So for me, my asthma journey started when I was about 3. I was living in Nebraska, running around like a crazy kid like normal people do, and then I couldn't breathe. And they took me to the hospital a couple times, and they said, well, here's an inhaler, just suck on this when you can't breathe. So we'll get to that in a second, but if you're liking videos like this, if you want to know the real cause, check out our TikTok channel, check out our YouTube channel, whatever you need to do as far as getting informed, because there's wisdom to be had instead of just information about how to treat your symptoms. Okay, so conditions start, your condition, if you will, asthma for example, starts when all the conditions are just right, like airway constriction, airborne irritations, crappy food, inflammation in your gut, things like that. Those are the root cause. That's the perfect storm that comes together and then triggers the reactive airway, which are the lungs. Because asthma, like every other diagnosis, is just simply a name that they put on a bunch of symptoms. Okay? Wheezing, constricted airway, which means you can't breathe, air hunger, and things like that. Those are all the symptoms. When you understand that those are just symptoms of the broader picture, then you can take a step back and say, what are some of the factors, right? When I was a kid, I'd play in haylofts, and I'd have to go to the hospital because I'd have a hay reaction. In fact, I just went to Florida this past fall, actually this past December, and I was riding around a farm where they harvest hay, and I started having a reaction. I was like, holy crap. And I thought I'd been asthma-free for several years. But the triggers happen, so we want to address the triggers and address what's going on there. If you or a loved one is suffering from asthma, understand that they're probably dealing with feeling fearful or timid. They could be fearing like something being exposed about them, like something being found out. Like lungs are about fear or being timid or like shying away. Like I don't know all the answers of what happened with me as a kid, but understanding like it felt like someone was not allowing me to be me in my territory. Like I couldn't be me because it was always dependent on somebody else's personality. Some people can have a fear of dying, that like literally from suffocation or being buried alive. Those are a couple threads related to asthma. These are brain issues, not like your conscious thoughts, or these are literally subconscious thoughts. When asthma comes around, the asthmatic will typically be sensitive to airborne things. So one of the metaphors is like, I prefer my air to the air of others. So that means I don't like to be imposed upon in my territory or having somebody like encroach upon me or my space because I feel suffocated, right? It's like I want what it isn't and I reject what is. That's another thread related to asthma. These are just different things I'm coming off the top of my head as far as what are related to. So if you haven't worked with somebody who has actually addressed the root cause of asthma, then you're just taking medications. You're just taking the inhalers, which could be an albuterol or there could be corticosteroid inhaler, things like that. Some people use nebulizers and all kinds of things they use to treat it, but they're actually just masking the symptoms. Because as soon as the inflammation goes down, it's still under there. You're still like putting black tape over a check engine light, so the red light goes out. So we work with people all day long with asthma and things like that. I have personally lived with it and overcome it by working on my brain. You can only do so much by working on the gut and working on the airborne, because you can't get away from the air. Like you'll get the air quality warnings like asthmatics stay inside because the air quality is piss poor. That's not helpful. Like how can you live your life? You're gonna have to we joked that I had to live in a bubble as a kid. And like that's not helpful. Nobody wants to live in a bubble. So understand that airborne allergies are out there, but what happens is it's a reaction inside of your body or the person you love's body that's creating the asthmatic symptoms that's causing the problem. So you must heal the brain. You must heal the triggers that are causing this person to slip back into this mode of the inflammation in the airway. And we talked about the stretches. You can go back and review those in a second, but just know that it requires someone who is skilled at understanding the multiple facets. What's the biochemical? What's the structural, if you really think of the airway? And then what's the neuroemotional? How does the immune system and the brain, how do they interact and stuff like that? We call it the triad of health if you're not familiar with it. So let us know in the comments below if you know someone who's suffering with asthma or would like help or needs help and is tired of medicating it. Because I finally told my asthma and allergy specialist, doctor, I think it was in 2011, somewhere in there, I was like, I love you guys for who you are, but you're just not helping me. And I think that the risks outweigh the benefits. And they told me, no, but we really think the benefits are always the risks. But they were coming from the standpoint of the only way they could help me is to clear my airway and help me reduce the inflammation. That's not helpful because it wasn't curing me of anything. It wasn't helping me resolve the issue. So get with somebody who knows how to teach you how to help yourself, can unburden you, help you touch on the points that are really limiting you. So let us know how we can help you. Let us know in the comments if there's someone you need help with assisting in their journey. And let us know what you'd like to address next. I mean, it's really important we provide valuable information. I'm obsessed with this. This is what I do every day, and I'm sure you can feel it from how I project it into the world. But I want to help you stop your unnecessary suffering, because if you or someone you love is suffering from asthma, it really doesn't have to be that way. But if you're not thinking differently than what you've been told by the medical profession and masking the symptoms and treating the symptoms, you're just going to get stuck with that and taking medication for the rest of your life. So we know it can work for you. This is how we do it. If it's not your jam, cool. Let somebody else know who it might be their jam, the way they want to approach things, and we're excited to serve you or them at any point in time. All right, guys? Have a wonderful night, and we'll talk to you tomorrow for the next segment. All right, bye.